in practice over 20 years at this point, and this is the best program I've ever brought into my practice. I now am able to dispense medications from my office, all medications that I write scripts for, but the exciting thing about it for me is that I get to dispense these new nutritionally based medications called medical foods. They are amino acid formulations that work on neurotransmitters, and they essentially are able to treat disease and manage it without any harmful side effects typically associated with the traditional generic pharmaceuticals. They have excellent clinical studies, they require a prescription, and they're reimbursed by insurance. The medical foods are regulated by the FDA, are prescribed for specific diseases, which are most of the major disease categories I treat in my practice, including such common categories as pain, inflammation, sleep, depression, anxiety, cognitive dysfunction, hypertension, pulmonary disease, viral disease. I treat musculoskeletal problems and pain. I prescribe Theramine on practically every patient. We have Tretpidone for osteoarthritis. It could also be used in combination with a non-steroidal anti-inflammatory, and it can be combined with Theramine for added pain relief effects. This is called a convenience pack, Theraprofen. As you can see here, it's Theramine and ibuprofen 800 milligrams. If we open up a co-pack, what we see in here is a conveniently packaged a bottle of Theramine and another bottle of ibuprofen 800 milligrams. All of the medical foods have a very, very minimal side effect profile. These medical foods have minimal to no drug interactions and a very high safety profile with very little patient resistance. As you start the patient on the medical food, you're able to start to lower the dose of the generic pharmaceutical that you might be utilizing. Patients love the idea of having a nutritionally based, cutting-edge program that's paid for by insurance. Just like you've had samples in a closet in your office, you could now have the medications which you're going to dispense under a lock in your office with a very simple system and program to dispense them at your front desk. It takes somewhere between 1 and 3 minutes per dispense, a very easy program, and it's very profitable. There is no effect on your malpractice insurance. There is essentially no cost to get in and very minimal risk to begin this program. Many physicians ask, isn't it a conflict of interest to dispense medications from my office? Well, right now, physicians are getting cut back every which way, with costs of maintaining a practice increasing and reimbursements from insurance companies going down. You could think of physician dispensing as taking an x-ray in your office. You have the option to send the person out to a radiology clinic or to keep an x-ray in your office. Any in-office ancillary service is exempt from any stark conflict. And in fact, the government is in support of this in the sense that physician dispensing has shown to overall reduce healthcare costs by enhancing patient compliance. The medical foods give an additional reduction of healthcare costs by avoiding complications typically found with generic pharmaceutical drugs. Starting the medical food program is quite easy, and then once you begin, it's easy to integrate into your practice. We register you as a dispensing site. Our representative will help you, and this can be done through our website at www.pdrmedical.com. Once you are registered, we will do an on-site training of your staff. We will train your MA, receptionists, or office assistants, as well as the physician. Our physicians will guide you in your initial formulary. We essentially typically recommend starting the program with a month's worth of medications. We manage your inventory electronically online. We're also doing the billing and collection for you and supplying you with a monthly report. You're immediately collecting money on this program because you're collecting the patient co-pays in the office. I've set the copay at $15 per prescription in my office, which is typical for most PPO practices. The additional money comes when the insurance pays on the claim, which will average between $40 and $60 total profit per dispense at the time that the insurance reimbursement comes in. That typically takes about 2 to 3 months when you first start on the program. Most importantly, you can now add to your practice a new clinically proven FDA regulated program allowing you to reduce side effects with the nutritionally based medical food program.